Welcome to It's All in Your Head, presented by Swingle and Associates in Vancouver. We've already experienced back-to-school advertising, if you can believe it, and for some parents it's a difficult time, especially if their kids are autistic. The amount of kids diagnosed with autism has risen dramatically in recent years, and on today's show we'll talk about the possible causes and treatment of what is still considered a mysterious condition. The star of our show heads up a clinic that offers completely natural, drug-free treatment for all kinds of conditions. For 7 years, he lectured at Harvard. Prior to that, he chaired at the Faculty of Child Psychology at the University of Ottawa and was clinical supervisor there for 10 years, ending 1997. Since then, he's been here in Vancouver, one of the leaders in biofeedback and neurotherapy, a safe, medically certified treatment to a wide range of conditions that originate in your head. Good morning, Dr. Paul Swingle.
Good morning.
We're going to cover what biofeedback neurotherapy is and how it works, autism, Asperger's, the differences between the two, the relationship between diet and autism, and the role certain vaccines may play in the development of autism. And plus, we'll hear some success stories from patients who have gone on to live normal lives, and we'll even touch on the book, Getting Adam Back. The telephone number at Dr. Swingle's clinic is 604-608-0444. It's also a very special edition of this program. It is our final edition after 3 years almost.
Mm-hmm.
Well, I'm sad to see that you're moving on from radio, but now that your book is out, it's going to achieve a lot of that purpose. But I've certainly learned an awful lot during the course of these last 3 years, and I really appreciate it, as do our listeners. And I know you've helped a lot of people that have listened to this program.
We've had a lot of response to this program. As you said, now that the book is out, I think the purpose of the program was to get the word out to the folks, and now the book hopefully will do the same thing.
Are you going to keep some of the past episodes of this program on the website still?
Oh, yes. They're all archived on the website.
Which is swingleandassociates.com. That's swingleandassociates.com. Before we get into the meat of autism, Asperger's, two words we're hearing a lot more, unfortunately, in this last decade. Let's talk a little bit about what you do. And when you hear neurotherapy or brain mapping or biofeedback, I think a lot of people, they're scared because you're dealing with the brain and you're talking about changing brain waves and all this kind of stuff. But that's fictional. What exactly is it that you do?
The bottom line is what we do is we look for inefficiencies in the way the brain's processing information. All of our symptoms and behaviors are associated with brain activity, obviously. And if we can find the area of inefficiency associated with a symptom and normalize brain functioning, the symptom goes away. It's that simple. An example of that might be somebody going to a gym. Their left arm is weak, so they exercise those muscles more vigorously than the others to bring it into balance. The principle of the treatment is based on the concept of brain plasticity. What we were taught in medical and graduate school when I went to school is just wrong. We were taught that what you were dealt with is what you had to live with. And if you had autism, well, too bad. We'll put you in a special corner of the room and hopefully you won't bother people. We've learned a lot since the mid-1960s in which people like Neil Miller and DeCara at Columbia and Barry Sturman at University of California, LA, and Joe Camilla at University of Chicago all demonstrated that animals could control brain activity and they could control autonomic activity like blood pressure, heart rate, thermal regulation, and so forth. And interestingly, once they brought them into a different state, it was stable. So that demonstrated that you could exercise volitional control over autonomic functioning. Now, everybody listening to this show knows that's a fact now, but in the 60s, that was revolutionary. Controlling brain activity was more of a challenge because of the computing power we needed to be able to do that. So in the early 60s, the primary use of neurotherapy was for treatment of drug-resistant epilepsy, very costly treatment. Now, of course, we have huge computing capabilities. So this is a primary care option for things like autism, Asperger's, depression, sleep disorders, and so forth and so on.
You talked about identifying inefficiencies. That's the first challenge when somebody comes through the door. So let's talk about that first. We're talking about the electromagnetic fields that your brain gives off, the pulses that they give off that you measure.
What we're looking at is the electricity coming from your brain. If you're measuring brain activity, you get a lot of brain waves. That is, the brain functioning gives off electrical current, EMF fields. Now, we know that certain brain waves are associated with certain things in certain areas of the brain. So, for example, slow activity in the back of the brain is associated with quieting and sleep. Too much slow activity up in the front right part of the brain can be associated with poor impulse control, the problems that Asperger's kids have in terms of just not having the social skills to interact. So we've learned a lot about what the brain should look like. And what I do, first thing that I do when somebody walks in the door is we do a very quick assessment to determine what kind of inefficiencies we're dealing with, and then I tell the person why they're sitting in front of me. The brain is that accurate. Now, with more complicated things like autism and Asperger's, we typically also at some point do a full brain map, and that's all 19 sites simultaneously because we're trying to determine the inefficiencies in how the brain's talking to itself, so site-to-site communication. And we know a lot about that in terms of patterns that we see with autistic kids and adults, and as that's distinguished from Asperger's.
He's Dr. Paul Swingle. You're listening to It's All in Your Head. So you talked about identifying the problem. Let's talk about fixing the problem through neurotherapy biofeedback. You've identified there's an inefficiency somewhere in the brain that's leading to a type of condition. How do you go about fixing it then?
There are three general classes of treatment in neurotherapy. The first, and the one that most people are aware of, is biofeedback for the brain, which, by the way, is the title of my book. What we do is we set it up so that when the brain is doing what we want it to do, that is moving towards more normal functioning, you'll hear a tone or you'll see something move on the computing monitor, and it's telling you about a brain activity you couldn't possibly feel, but you make use of that information to learn how to self-regulate and normalize brain activity. Now, for kids, we set it up so that they're playing a video game with their brain. When the brain's doing what we want it to do, bugs move across the screen, spacecraft fly, dolphins jump out of water. We have all kinds of razzle-dazzle games that the kids play. The second class of treatments, and these were largely developed by myself and my clinics, is referred to as brain driving. A lot of autistic kids can't participate in something like a video game. They're just not capable of that kind of interaction, that kind of volitional attentive behavior. So we've developed procedures that are non-volitional. We measure a particular aspect of brain functioning. Based on that measurement, we stimulate with light and sound for kids. For adults, we add EMF fields, electrostimulation, and so forth to nudge the brain into more normal functional ranges. It's the use of that technology that permits my clinic to treat pretty severe autistic kids. We're one of the few clinics in North America that accept very severe autistic kids for treatment. Now, the other aspect of the treatment of autism is neurotherapy is not a standalone treatment for autism, and any parent with an autistic child knows that intuitively. You need some play therapy, you need behavior therapy. Parents need some coaching in terms of how do they respond to the behaviors of the autistic child. Diet is huge with these kids, supplements and so forth. So there are a lot of things that parents do in terms of trying to treat these sorts of things. Now, parents are always leery. On average, parents of an autistic child have tried 7 alternative therapies. Most of them are nonsense, absolute nonsense. And unfortunately, in neurotherapy, we have a lot of franchises popping up, hobbyists who will claim to treat all sorts of things, and they just don't have the wherewithal, backup, nor training to do it. So parents have to be very cautious about how they enter these things, and they're cautious when they enter my office, as they should be.
We are with Dr. Paul Swingle for the hour. We're going to talk about the difference between Asperger's and autism, and what do we know that may affect or cause autism in kids. There are 3 things, and you'll be shocked to hear what they are. Dr. Paul Swingle and Associates, 604-608-0444. And we're talking Asperger's and autism today on the program. We encourage you to read the book, Biofeedback for the Brain, available at your favorite bookstore. We've heard of autism. Perhaps maybe those who aren't familiar, just a quick characterization of the type of child that comes in who has symptoms of autism.
Mm-hmm. The hallmark for the autistic child is they're not aware of you. They don't interact. They're less aware of their surroundings. Now, there may be other cognitive developmental issues as well. They may be developmentally delayed. They may have some fine motor issues. Communication is usually problematic. Eye contact is usually very, very poor. Now, one of the fundamental distinctions between autism and Asperger's used to be considered high-functioning autism. There's reason to believe that it's a different mechanism. The difference that we find, an autistic child doesn't interact with you because they don't recognize that you exist. Their notion of you as an emotional being is not substantiated in areas of the brain. The Asperger's child, on the other hand, wants to interact with you. They are very, very deficient in social skill development. These are the kids that are in your face, standing on your shoes. You're trying to get away from them, and their interaction with individuals tends to be extremely negative because they're approaching all the time. They don't have the social skills to do that in an appropriate fashion. So these kids, once we get the area of the brain to light up that's associated with that development, that learning, these children progress remarkably when working with behavior therapists. So we work in conjunction with a lot of behavior therapists who are doing the behavioral part of the treatment.
Let's talk about some of the believed causes, because now I'm not sure if we have statistics on, how much more autism is being diagnosed these days, but we just hear so much more about it. We hear about celebrity parents who are talking about their kids having it. We had a day on CNN not so long ago. They were dedicated an entire day to autism. So what are some of the things that scientists and doctors now believe may cause autism?
Well, first, in terms of numbers, it's just been an explosion in terms of kids being diagnosed with autism. Some of this, of course, has to do with our improved ability to diagnose these sorts of things, but that's not really the issue. We're now in a situation in about 1 in 150 kids is diagnosed with an autistic spectrum disorder. That includes autism, Asperger's, some pervasive developmental problems, and so forth. The causes of these conditions vary. The first issue is that some kids have a vulnerability, a predisposition. Now, we know there's a genetic component. Identical twin studies, schizophrenics, for example, 50% of an identical twin of a schizophrenic will have schizophrenia. 50% won't, though. With autism, it tends to be a bit higher. About 30% don't. Now, what that means is that you need something to turn the key. You need something to turn on the gene or the predisposition for these conditions. And there are a lot of things that will do that. It's been pretty well established that the mercury in the early vaccines, there's some still in some of them, that's the thimerosal, was associated with autism. There was a lot of research indicating, that there was no causal link. But if you look at it in terms of vulnerabilities, then that was one of the causes. Pesticides. Very compelling studies coming from the health departments from the state of California. Families that live close to fields where pesticides were being used, there was a 6-fold increase in autism. Individuals who live close to power plants. This was research done recently at the University of Texas. 2% decrease in autism every 10 miles away from the power plant. Now, that's pretty compelling. Now, we get to other things like cell phones, EMF fields. A lot of research going on there that's indicating that the EMF fields, cell phones, and so forth is contributing to this problem. That's hard to substantiate. Doing research in that area is very difficult, but Dr. Busco published in the Australian Journal of Environmental Medicine this year pointed out that individuals that were close to these high Wi-Fi, is that what it's called?
Yeah, wireless networks. And cell phone towers.
Cell phones, cell towers, and cell phones. There was a 60% increase.
60%?
Mm-hmm. Low birth weight associated with autism. Another thing that's been of concern is our rather cavalier use of imaging. So a lot of mothers are getting a lot of CAT scans and so forth. Have to be very careful of that because the brain is extraordinarily susceptible in a young child. So The bottom line, there's a predisposition. The brain is very susceptible to toxicities, exposure to any of these things that affect the cell membranes so that you get heavy metal impact. That seems to be the mechanism. Now, interestingly, they find that autistic kids are deficient in glutathione, which is one of the elements that's protective against heavy metals. Interestingly, autism is about 4 times more prevalent in males than females. Females have a much higher inherent rate of the glutathione and the antioxidants generally. So it all fits together. And mothers all know this. You have to protect the child. Okay? And you have to protect the child against additives, EMF fields, pollution, insecticides, mercury in vaccinations. All of these things are contributing factors.
What about, are we talking about pregnant mothers, nursing mothers? Can you get autism as a 1, 2, 3-year-old, or do they know when it generally begins?
That's interesting. When I first started in this area, we didn't get autistic kids in for treatment until they were 2, 3 years of age, that sort of thing, because that's when it started to become apparent that they just weren't going to catch up socially. I like to emphasize that mothers know. Mothers know very, very early on that something's not quite right. And I really want to encourage mothers to trust your gut. Mothers, you outrank everybody. You go in and you tell them what it is that they have to do. They don't tell you. And you know when something's not looking correct. Now, there's a natural reticence to do that. Mother wants to feel, well, if I put a little more effort here, a little less effort there, feed him a little better, etc., that he'll catch up. Pediatricians are reluctant to say, well, this may be autism, let's chase that for a while, and for all kinds of obvious reasons. We now know that you can identify these things very early, and there's some very interesting research that just came out in terms of retrospectively looking at videos of first-year birthday parties of kids with autism, now diagnosed with autism, versus those that weren't. You can pick it out. You can pick out every autistic child because they don't interact in the same way. And that's at 1 year of age. You can't tell me for a moment a mother didn't know that.
In just a moment, we're going to talk about diet and also the book Getting Adam Back. And you were not going to believe the kind of diet that is prescribed, if you will, to somebody with autism. Dr. Swingle is thrilled to have his book out, Biofeedback for the Brain, and encourages you to pick yourself up a copy at your favorite bookstore. And the telephone number at the clinic is 604-608-0444. And if you go to the website, swingleandassociates.com, you can contact the clinic if you have any more questions. We've been talking about autism and Asperger's, and one of the best testimonials we've heard on past programs with this theme has been that of the mom of a kid named Adam. And maybe you'd like to tell the story, Dr. Swingle, because it's probably one of the best examples of how a mother outranks everybody and that this is a condition that can be overcome.
The book, Getting Adam Back, is available on gettingadamback.com. Adam's mother, Arlene Martell, came to me, this goes back 8 years or so ago. She was told by her treating physicians that they recommended that they put Adam in a crash helmet and institutionalize him. And she said, enough of this nonsense. Very courageous woman. She did enormous amount of research to try to find out what you could do for a child in that kind of condition. Now, Adam also had a seizure disorder. He had epilepsy. And a lot of autistic kids have comorbid conditions, and seizure disorder is very common in autism. So the first thing that she did was she put him on a ketogenic diet, and that's a very high-fat diet. Now, part of the issue associated with these things, as I indicated before, is there's a bowel problem in these kids. Absorption is affected, they have leaky gut, and so forth. So the ketogenic diet probably addresses that to some extent. There's also a problem with the myelination of the neurons in these conditions, and it's possible, I suppose, that the ketogenic diet addresses that in some fashion. We did neurotherapy to correct the seizure problem. That is, there's a very specific treatment that we do for very specific forms of epilepsy. In this particular case, it was increasing one particular waveform over the center of the head. Got his seizures under control, then we addressed the autistic aspect. And Adam, like many kids, had a deficiency in the right prefrontal cortex. We lit it up. And as I said, Arlene was doing a lot of other supportive therapies, behavior therapy and so forth and so on. And if your listeners go to the website and look at the cover of the book, or in the book, there's a picture of Adam in his tuxedo graduating from high school.
This was a kid that was told he needed to be institutionalized and in a crash helmet.
That's correct. Neurotherapy contributed to the treatment of this child, okay? And there were a lot of other things that Arlene was doing. And I encourage anybody who has an autistic child to have a look at the book. It tells you a lot about what can be done.
The book is called Getting Adam Back, the website gettingadamback.com. Let's back up a little bit to that diet you were talking. The ketogenic, did you call it? High-fat diet. What are we talking about here?
Eat lots of hamburgers.
Hamburgers and French fries and ice cream and things like that?
All kinds of that stuff.
Really? Well, now that could be dangerous, too. I mean, you're telling a kid it's okay to eat all this fat food.
They titrate them off once you get the seizures under control. We have a lot of very young children that we're treating for seizure problems. Some of them have 100 seizures a day. They put them on ketogenic diets, and we do some neurotherapy to try to normalize the activity of the sensory motor cortex. We have a couple of kids that are 6, 7 months of age who have these huge seizure problems. The problem is the anti-seizure medication has major impact on cognitive development, so it really, really delays them terribly. And the sooner that we can get them off that medication, get the seizures under some degree of control. But unfortunately, mothers are out at sea with this. You know, there's very little support for doing these things outside of the use of heavy-duty anti-seizure medications.
When we talk about titrating off, whether it be diet or whether it be medication, this is a really important issue that has come up before in this program. You can't just all of a sudden stop taking medication or say, well, I'll cut this pill in half and that kind of thing. And the same with the diet. And that's perhaps a point we should make, is that it's really important that you get done properly.
Absolutely. We work a lot with the physicians who are running the meds in terms of titrating off very, very slowly. People are obviously and understandably in a hurry. You know, once they are feeling, depression is a good example of that. Once they're feeling good with the treatments that we do, they say, well, I don't need this stuff. And they chuck it away, and that's a huge blow to the central nervous system. And they may get rebound effects and so forth. So right from the get-go, we tell people, when it's obvious that you can start to titrate, then we want to work with your physician, titrate very, very slowly.
We have a full phone board right now, so let's take some phone calls. Hello, Bob. Thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head.
Okay. Dr. Swindle, I'm wondering if there's any treatment for a brain that has been deficiently provided with oxygen during a surgical procedure, which left me with symptoms of stroke. Is there anything that can be done for a brain in that condition?
Yes. We see a lot of this kind of thing. Also with kids, very often they have umbilical strangulation so that they're oxygen deprived. And we have a lot of this with surgeries and with stroke. There are several things that we do. One is called hemoencephalography, which is a brain feedback procedure in which the feedback is on blood flow, not brain waves. They're correlated, of course. And we can increase the blood flow to the frontal cortex, which is the principal area that's affected by oxygen deprivation. We also do neurotherapy in the front part of the brain. And likewise, if we are able to suppress the slow wave frequencies, which tend to build up with oxygen deprivation, then we can light up the frontal cortex.
Bob, when you talk about the symptoms, the stroke-like symptoms, what type of symptoms are you talking about?
My main symptoms are inability to function from the knee down on my right leg. I don't have any control of my leg from the knee down. And so it makes it difficult to walk. I am ambulatory, and many of the symptoms that I initially had following the operation have disappeared. My right arm is okay. I can write again. My face has returned to a normal feeling, but it's simply in my leg, and I'm not able to walk properly without a cast, but I am ambulatory.
Okay. That sounds like, rather than the frontal part of the brain, it's probably over the sensory motor cortex. We have a fair number of folks that we see for that, in which we basically normalize the area that has been affected.
How about neurotherapy in combination with, say, hyperbaric oxygen therapy?
Yes. Very often that can be helpful as well. And neurotherapy in combination with some physiotherapy with very specific treatments. One of the things we wouldn't be doing in this case, but for example, if one arm is badly affected, there's a restraint procedure that's used after we light up the area of the brain responsible for that particular motor function, then we restrain the good arm and force the use of the affected arm. That was a procedure that was developed by Dr. Wolf in Minnesota about 10 years ago. Very, very effective once you light up the area of the brain.
You've also developed harmonic CDs, which you might use in this kind of situation as well?
Yes, we probably use one that stimulates that particular area of the brain as an adjunct to therapy, yes.
Bob, Dr. Swingle's number is 604-608-0444, 608-0444. Give the clinic a call and let them know why you want to visit the doctor, and we'll get you started. Our favorite listener, Candy, is here. Thanks for waiting, Candy. You're on with Dr. Paul Swingle.
Thank you. I was holding off my call because I didn't want to be blubbering. The fact that you guys are leaving, it's just really upsetting. I really appreciate both of you. I was just wondering, you have a whole audience of interaction, and will you be doing seminars? Will we have the opportunity to hear and interact in the future?
Yes, we do at least one pre-public lecture a year, and I also lecture a lot to PTAs and brain injury organizations and so forth, and all of those will be listed on the website.
Well, I just want to thank you for the educational opportunity that you so generously offered to us. It's a real blessing.
Well, thanks for the kind words, and thanks for calling all the time and having such wonderful questions.
I appreciate the opportunity. You know, there's a combination of hope and legitimacy that you have given your audience, and it's very, very unique. I want to thank you for that.
Thank you.
Candy, she had always, every week, a great question. It was always very, very poignant. And let's talk to Helen. Hi, Helen. Thanks for waiting. You're on with Dr. Paul Swingle. It's all in your head.
Hi. Thank you for taking my call. I have a lot of depression and back problems since my head injury. And I've had the sciatica problem, but I'm dealing with it. What are your suggestions that I can continue to do?
Is that like the sciatica nerve down in the tailbone there?
That's right, yes.
Yeah, down to my toes.
Right.
Yes.
Physio, chiropractor did not help at all. Mm-hmm. But I've done acupuncture, and that's the only way that helps me.
Yes. Interesting. A lot of our clients find acupuncture beneficial for this condition as well. With head injury, what we do is we immediately do a full brain map. That is all 19 sites, because in head injury we get a lot of problems with brain site to brain site communication. So once we get that normalized, then it makes a tremendous difference in terms of motor function and mood state. Now, the depression and head injury almost always implicates the frontal part of the brain because of the way the brain sits in the cranial vault. Doesn't matter how you're hit, you're going to have some frontal implications. What we do is look for the markers for depression that are associated with the brain injury, normalize those, and that can make a tremendous difference as well. Then we also do some other therapies, physio-type therapies in the clinic while the brain is under treatment that can be effective for some of the sciatic pain.
Now, we talked actually recently about fibromyalgia and constant, maybe perhaps stemming from an injury of some kind. You'd be able to know for sure whether that's the case or not in Helen's case.
Fibromyalgia is a high probability anytime you've had a serious injury. There's several factors that contribute to fibromyalgia, head injury being one.
Thanks for the call, Helen. Dr. Swingle's number again is 604-608-0444, 604-608-0444. We turn to Ramsey, whose wife has a seizure issue he'd like to talk about. Hey, Ramsey, thanks for joining us. You're on with Dr. Paul Swingle.
Hello, Dr. Swingle. Thanks for taking my call.
You're welcome.
I would like to know about complex partial seizure. This is for my wife.
Yes.
She's suffering from that. Actually, what happens is every month she's getting that complex partial seizures.
Yes.
Like she'll be staring without even knowing what's happening around her. Mm-hmm. That goes on exactly for 1 or 2 minutes. and after that she'll be okay.
Mm-hmm.
That keeps repeating for at least 4 to 5 times within an hour or two, and it also follows the next day, and that's it. And she'll be okay for the next 28 days, and then again after 1 month she gets the same kind of problem repeated.
Mm-hmm.
And we are thinking about all the kinds of causes for that, and she feels it is probably due to her menstruation time or something like that, and she is not really sure. And when such thing happened one day, when I checked her blood sugar, it was 277, and her BP was also high, it was 220, and I don't know if it has got anything to do with that, and we are really worried and confused. I would like to hear about that from you, please.
I had a friend that had that same issue, actually, and it's weird because they space out for a moment and actually for quite a time. Interesting.
Yes, there are a lot of different seizure disorders, absent seizures that you have with kids that tends not to be diagnosed very efficiently. And that's because they just kind of stare at you for a moment or two. They're not there. You think they're daydreaming. The kind of seizure that this fellow is describing, again, is quite common, in which a person is just not there for a period of time, even though you don't have any thrashing or any other things that would lead you to immediately suspect seizure. Seizures that are coincident with the menstrual cycle are very, very common. And what it is hormonal changes affect specific areas of the brain. The very specific treatment for that is to increase what's called the sensory motor rhythm over the sensory motor cortex, which increases seizure threshold. And then we teach people how to use a home treatment procedure that they can use to increase seizure threshold and abort the seizures. An example of that is I had a woman who discovered that she was pregnant and she was on anti-seizure medication and really frightened by it because of some of the birth effects of some of these medications. So we did the neurotherapy and taught her a home procedure that she could use to suppress seizures, and she was able to come off half the medication within 3 visits and was totally medication-free within 10. She was fortunate in that she had what's called a prodromal. She knew when a seizure was coming, so she could avoid it with the procedures we showed her how to use at home.
So many issues regard to hormonal changes, monthly cycles, whatnot. Migraines, you've dealt with those as well.
That's correct.
Again, Dr. Swingle's number for you, Ramsey, is 608-0444. Swingle and Associates on the website, swingleandassociates.com. And let's take a call from Rosemary, who's been patiently waiting. Rosemary, you're on with Dr. Paul Swingle here on 1410 The Buzz of Vancouver.
Hello, Dr. Swingle. I wondered if you have been able to help people with obsessive-compulsive disorder.
Oh, yes. We see a lot of that. One of the things I discovered about 12 years ago when I was at Harvard Medical School is that we can access an area of the brain referred to as the anterior cingulate gyrus, which is in the front of the brain underneath a few centimeters. And that's the seat of the behaviors associated with obsessive-compulsive disorder. What they used to do at McLean Hospital for these severe cases is called a cingulotomy, in which they sever the relationship of that structure with the rest of the brain. Unfortunately, it was only about 25% effective, and a lot of people the symptom would return after the surgery. So we're really thrilled with having found a method for accessing that from the front part of the brain.
And you know right away when you do a brain mapping assessment, that's the issue?
I often tell people, I don't ask them why they're there. I often tell them, you get something on your mind, it's hard to get it out.
And would you consider, for Rosemary's benefit here, this is an easy thing to solve?
No. The anterior cingulate gyrus takes some time to get that to respond. Now, we've had miracle cases that have responded really quickly, but serious disorders of that nature take a while to get the brain normalized.
Rosemary, thanks for your phone call. Ali, you're on with Dr. Swingle.
Hi, this is Ali.
Hi.
I had a question, actually. About 2 years back, I had a motor vehicle accident, and I was diagnosed with neuropsychologist. It was basically a concussion. So I had all, symptoms of depression, as the neuropsychologist told that I had some damage to my frontal lobe. And so I was depressed for a while. I took some medicines like Effexor. I'm much better now, but there's still some residue left. I was wondering the technique that you're talking about, how effective would be in cases like mine. And also my second question is whether it is recognized and can be compensated by insurance companies like ICBC.
Yes, we're registered psychologists, so it's covered by extended medical up to your cap. ICBC has supported the treatment when the case has been settled. We see a lot of folks with closed head injury, and as I mentioned to an earlier caller, almost any head injury affects the frontal lobes because of the way the brain sits in the cranial vault, and that affects personality, depression, and so forth. Our hit rate is very good in the treatment of these conditions.
Let's take one more call from Tova. Hi, you're on with Dr. Paul Swingle. It's all in your head.
Yes, hi. I wanted to ask, my mother is 79 years old, and she has, they say it's a Frontal-Lobe Ataxia, and she can't walk very well, and she has also no balance. She has a problem with, they said the brain stem, I don't know where the balance comes from, and so she's basically in a wheelchair, and she's really pretty upset because she's only 79. She was a very active lady, and now she has to be in a wheelchair, and everything has to be done for her. She can't get up on her own. She has no strength in her legs at all, and it's just it happened fairly fast for her. Is there anything you could do about it?
Frontal-Lobe Ataxia?
Mm-hmm.
Yeah.
Yeah, we see, again, quite a few folks in that kind of situation. We have a lot of folks coming in with walkers and wheelchairs and so forth. What we try to do is increase the efficiency of the areas of the brain associated with motor movement. Now, whenever it's a balance issue, it becomes more complicated because it can be a brainstem issue, it can be an in-ear issue. If you have an attack of vertigo associated with an inner ear problem, then there's some very specific treatments that are done for that in terms of some of the cells of the inner ear mechanisms. If it's a frontal lobe issue in terms of how the frontal lobe's talking to other areas of the brain, then those are things that we can address as well. Each condition is different depending upon what are the conditions that gave rise to it and how long the condition has been extant.
All starts with a visit there, Tova, 604-608-0444. Again, you can find everything you need at swingleandassociates.com, and that's where you're going to have to turn from now on. And the book, Biofeedback for the Brain, available at all the bookstores. Mm-hmm. I can't thank you enough for your several years here on 1410 The Buzz of Vancouver. I've learned a lot personally. You obviously helped me. I don't wake up at 2 o'clock in the morning anymore and then think until it's time to get up, which was a huge thing for me, especially given my weird hours. And I know that on behalf of all our listeners, they were very, very appreciative of what you've given them over the last several years. So thank you.
Well, thank you. I really appreciate your hosting this show. It made a huge difference. I appreciate it.